Hello, good evening, and welcome once again to Adolescent Youth SRHR Digital Platform. All right, so welcome to the show, and today we are going to discuss antenatal care and why it is important during pregnancy. So we are going to be joined today by Dr. Anita, who's going to shed more light on the subject matter. So let me welcome to the studio, Dr. Anita. Dr. Anita, welcome to the studio.
Hello, Dr. Violet. Thank you so much.
Kindly tell us more about your organization, Lotus by Nikita Training, and then now we can delve further into the subject.
Okay, yeah, thank you. I am Dr. Anita, and my organization is called Lotus by Nikita Training. We are an organization that focuses on maternal health education. We work with pregnant women, even pregnant young ladies, if you are in the bracket of being a youth, to help you have a positive birth experience. And this in turn reduces maternal mortality and just creates a positive experience for the whole community at large.
Okay, so kindly share with us what is that antenatal care and why is it important?
Oh, yeah, that's a great question. Antenatal care is like the care that is given to a pregnant woman specifically from the time that she knows that she's pregnant to when she delivers her child. This can be done at a health center, at a clinic, at a hospital, whatever you have access to. So if you're currently pregnant and you haven't gotten to the doctor, please do so. So it's whatever care that is given to a pregnant woman throughout her period of being pregnant and giving birth.
Okay, does age really matter when it comes to receiving antenatal care?
No, not at all. Any woman, any individual who is pregnant, because here we are on a platform of adolescent and youth. So if you're the time where you're 16 years old, 18 years old, even older than that, you are
All right, so we can hear from Dr. Anita that it doesn't matter as
Can you
long
hear
as
me?
you are pregnant. Yes, you are yes, you you broke off for a while. Yes, yes.
Okay.
Can you hear me? Can you hear me?
Okay, I was saying it's the matter of the fact is that as long as you're pregnant, antenatal care is for you, and you're advised to go to the hospital to have that specialized care for you.
Okay, so what usually happens during antenatal care? Kindly take us through the process so that if there is a lady who is pregnant for the first time, they can get to understand the process, if there is a book they have to write or anything that is supposed to be undertaken during that period.
Oh, okay. That's a great question. So, what happens and what do you experience when you go for antenatal care? So, as soon as you learn that you're pregnant, most people take home tests, or most people go to the hospital because they have other symptoms. And then they find out they're told, hey, you're pregnant. Next time, go to the other side where pregnant women go. And you're like, hey, I don't know if I'm supposed to go there. I'm young. So, what happens, first of all, this care is specialized for you. Is that the first thing that happens is you create a bond with this medical team that will follow you through. When you go there, the first visit, they take your history. What we mean by history, they get to learn about you, any other diseases you may have had before. If you have like hypertension or diabetes, people have that. And then they may do certain tests. They may take an ultrasound for you, and then they now start following you through, depending on there's a factor of insurance, but depending on whatever case you have, if you have chronic diseases, or if you're just a pregnant woman who needs to be followed through, now they start giving you different appointments. And what they do in each consecutive appointment is take tests, follow you through to see if there's anything that is popping up that may be dangerous for the health of your baby or for your health, such as hypertension while you are pregnant, which is called preeclampsia, or diabetes while you're pregnant. And then they continue supporting you throughout the whole journey to make sure that you and baby are healthy. And this continues up to when you give birth.
Okay. So how many visits should a pregnant woman take to the health facility?
So we say eight. Eight is like the good number, but we know what reality happens. So if you have maybe a chronic disease or a situation that needs closer follow-up, it may be more than eight, but eight is a good number. We say around the first trimester, when you're around 12 weeks pregnant, by the time you're 12 weeks pregnant, we hope that you would have gone to a health center or a clinic or a hospital to start those antenatal care visits. And then now after every 4 weeks, depending on what the clinic is giving you, the appointments they give you. And then around 36 weeks pregnant, they give you around 2 weeks, 2 weeks towards the time you're about to push baby out. So eight is a
Okay.
good number.
Wow. So let's say a woman has missed the first antenatal care visit to the health facility. Will that pose a danger to the baby?
Can you kindly repeat the question?
Yes. So if a pregnant woman misses her first antenatal care visit, will that pose a danger to the baby?
If she misses the first one, most likely would say no. But for like just to give you a good start with the follow up, it would be great for you to go that first visit. But if you don't go the first visit, the second visit, please go. Then like the earliest time you get an opportunity to go to the hospital, please go, because the first time as I was saying about the visits, they take lab tests and then they get to see if you have a good blood count. They give you vitamins, they give you iron and folate, and then they also follow through with some vaccines that you may need to protect you and baby. So if you miss the one before 12 weeks, the next earliest time you get an opportunity, please go to the clinic or to the hospital.
Okay, so there might be maybe a woman who's watching and she's saying she doesn't care. She won't go for any of those antenatal care visits. So are there any dangers if you don't go for those visits?
Yes, there are many dangers. As I was saying, one of the aims of antenatal care visits is to reduce maternal mortality, which is reducing the possibility of a woman dying from complications of being pregnant. So while you're pregnant, you may have an instance where you have anemia, which means low blood in your system because of pregnancy and the complications that come from it. And that's when they find that, they may give you transfusion and they may continue giving you supplements to help your blood count go up, and so that you may have good health while you're pregnant. Another thing that may happen, you may have hypertension, as I said, and this one is may go to be such a serious situation where you may have seizuring and you may not be able to, if you're not able to get to hospital in time, it may bring dire consequences to you and your baby. Another thing is also diabetes. Not forgetting, when you go to the hospital, they also check, when they do the ultrasound, they check whether your baby is in a good position. So when you go to push baby out, you don't want you to start pushing baby out and baby is coming with the legs out. Basically, that also puts you in a very difficult position. So I was just pointing out complications that can happen if you do not go for antenatal care visits. Those visits help to protect yourself and also help to protect the lives of your baby that is about to be born.
Oh my, oh my. So so now the other question that I have is do public health facilities charge if you want to go for ANC visit, or do hospitals charge for it, or is it free, or how is it?
Ooh, that's a good question. I want you to answer that one. I feel like I've been out of the practice for a while. I know that you know the best that answer.
Yes,
Yeah.
yes, yes.
Yeah.
At least now that one I can answer. If they can go to, if maybe they have even Linda Mama or NHIF, at
Mm-hmm.
least it covers even the visits that they go to, because NHIF, courtesy of Linda Mama program,
Mm-hmm.
it comes through, especially now, even in supporting you even when you want to deliver in a health facility.
Mm-hmm.
Now, the other thing that I'd also like to ask you is is for the men who are watching this particular show. Uh, what is your advice to them? Should they encourage their women to go for these ANC visits? Because sometimes you find that men usually influence decisions even for women
Mm-hmm.
to go even for
Yes.
this visit. Sometimes you may find a woman doesn't go because the husband has said that
Mm.
that they should not go. So what is your what is your word of advice to any man who's watching this particular show, and especially speaking with regard to ANC care? Should they allow
Mm.
their wives or girlfriends to go for this visit?
Yes, that's a very, very good question. And even in my practice, whatever in my organization, what I do is encourage women, bring your man along, teach him what you're learning about labor, teach him the complications so that your man can help you. So yes, the men should actually encourage the women to come. They should even escort them first of all. Don't let your wife or your fiance or your girlfriend come alone. Support them, come with them, see the baby while baby's heart beats, learn anything that any complication that your wife is going through, and learn how to support her through that, or your girlfriend, any complications they're going through. And then while they give birth, also be there. I know it's something different from our culture and from what we have been told, but studies show that the woman who is supported, who has her partner there, has a better birth experience and better outcome in postpartum time. They have less postpartum depression because their partner is there to support them and to give them words of encouragement during this um, kind of hard time. Pregnancy is not all flowers and just easy times. So if the man understands that, they'll be able to show up and support the wife more better. So please encourage your women to come and have antenatal care visits.
Uh-huh. So you mentioned a terminology there, postpartum depression. What is that?
Mm. So this is, let's say, a collection of symptoms that come. It's first of all, the cause is from hormonal disturbances because of pregnancy. There's a great shift of hormones in a woman's body, and then it creates symptoms of being sad, crying, not wanting to take care of baby, and it lasts for more than 2 weeks. And when this happens, it means the woman may need more help, may need support from the doctors, or may need more support from family members. So it's something to watch out. It happens to even more than 50% of women. It's just because we don't have a term for it, but the woman suffers through it. So if you see any of these signs in your partner, in your wife, in your girlfriend, please try and talk to her. Please try and get her the help that she needs. I
All
hope I
right, all
answered the
right.
question right.
Yes, yes, you did. So
Mhm.
even there is a viewer who's saying here, keep going. Wow, keep going. So they are watching the show, and they are learning a lot from this if you have a question for Dr. Anita, kindly go ahead and ask your question. So right now, um, we are coming to the end of the show. So is there any closing remarks that you'd like to share, Dr. Anita?
Thank you very much. We are talking about antenatal care visits in regards to pregnant woman and her well-being, and that also calls about the well-being of the whole community. If you're a man who has a family and children, if the if you're if the or if you're a young lady, this will help you have a good experience at the end of the day. And also, when you go there, please ask for I know they'll take many tests, the STD test, the HIV test, so that they know that they're taking care of you. So do not be afraid of going there, even though there may be such a circumstance in your couple or in your relationship or in your life. They will be able to support you well. So as we were talking with Dr. Violet, antenatal care visits are important for you and for the health of your baby. So please do follow up.
Wow. Thank you so much, Dr. Anita. We are going to host you once again on this show so that you can share more on these subjects, because you know pregnancy covers a lot, and
Yes.
even as a medical doctor, you're going to at least help the viewers who are watching so that they can know the next steps that they should take.
Mm-hmm. Yes.
So
Thank you
thank
so
you
much
so
for
much.
having me.
Yeah, so thank you so much for gracing the show. See you next time, Dr. Anita.
Thank you.
All right, viewer. I hope you've learned a lot from this particular program, and that is the reason why we started this particular show, so that it can bridge the knowledge gap with regard to sexual reproductive health. So see you next time, even as we host Dr. Anita or any other guest who's going to shed light on sexual reproductive health. Thank you and enjoy your evening.